And to move on to CareLine Live specifically, we are, I run a care company. We've been operating for about 14 years now, Mega Care. We have tried a multitude of different systems, and we transitioned over to CareLineLive Live after we met at a health and care show. We saw the system, it was fantastic. We transitioned over in 2020, and we've not looked back. We've been, of course, often bombarded by many different competitors and showing their systems, but we have no reason to move. It's a very, very good system. You have strong operators and strong people that do the upgrades and update the system quite regularly. So in relation to CareLineLive, what big plans and upgrades do you currently have for CareLineLive in the future? What should we expect in the next 5 years that keeps CareLineLive ahead of the industry and the rest of their competitors?
So look, we from day one, CareLineLive has so it started by Josh Hoff, and he quickly brought Deck Norton, our CTO, into the business. I would say that they're the two founders of the business, and from day one, they've always envisaged being perhaps one of the top, if not the top, home care management platform, not just for the UK, but really globally. And actually, we have grown very well over the last 6 years, and that ambition is still actually what we are gunning for. So although at the moment most of our business actually is still largely in the UK, we are going to try and slowly become a solution for home care providers in other regions of the world, and eventually absolutely become one of the global players in home care. With that in mind, over the next 5 years, I think that so the vision of CareLineLive has always been to be a business in a box tool for domiciliary care, home care providers, which essentially means that the care operations of home care providers, we should help to help you run them as much as possible with our software. And I think over the next 5 years, we want to make our platform talk to other platforms much better.
So you have more APIs.
In the jargon, it's about interoperability.
Mm-hmm.
And what we would like to do is allow more information to flow in and out for you through CareLineLive. So one of the perhaps whether even you as a very loyal and intense user of CareLineLive have not realized is that over the last couple of years, we have spent a lot of our development resource into becoming an assured supplier, a digital social care records assured supplier. This is a program that is run by the UK's Department of Health, and it was a program whose aims was very much to help health and social care or social care providers in the UK to become more digitally enabled and use more digital tools. Now, as part of that program, essentially the standards were set, which were required, that would have a minimum set of standards for software providers to meet. It was quite an arduous process actually for us, and will continue to be. The program continues. But as part of that program, one of their big objectives also is for health and for social care provision, and social care providers to be able to interact with the health side as well. And that again comes back to interoperability. And so, yeah, I would say at a 30,000 foot level over the next 5 years, we absolutely want to make sure that we can help you get the benefits of information from other third-party sources that you may need. Now, as an example of that, already one of the standards we had to meet for digital social care records, assured supplier certification, was a program called GP Connect.
Yes.
Which is run by really the NHS, which is all about access to the GP summary record of end users. And so that's an example of how that will help you as a dom care provider run your operations perhaps not just more efficiently, but also be able to provide more person-centered care.
100%.
We have, since we launched GP Connect in October last year, a lot of our customers have come back and said that it's really, really helping them, because one of the big comments always is we no longer have to wait on the phone to GPs looking for information for our service providers, or we don't have to wait for emails to come back 2 or 3 days later. It's also, for example, helping you be more proactive. If you, on a GP care summary record, if you see that someone's meds have changed, you can react accordingly, etc.